Hi, I'm Tim Bradner. We're at the University of Alaska Fairbanks, the Governor Bill Walker's conference on the sustainability of Alaska, our financial future. And I'm Tim Bradner. I'm here with Val Davidson, Commissioner of Health and Social Services. Val, thanks for joining us.
Of course. Thanks for having me.
Val, this spring at this conference, everybody is sort of using as a template the cuts that were made, by the governor and by the legislature this year. But and the thinking is we may have to do it again, but just looking at this coming year, how did that impact the Department of Health and Social Services?
So our department took about a $92.5 million cut in the most recently passed budget, and the biggest component of those cuts were actually in Medicaid. We actually proposed about $20 million in Medicaid reforms and savings opportunities, and that we would realize in this next fiscal year. The legislature added another $31.5 million. So it's a total cut of about $51.5 million.
And Medicaid is the biggest part of your budget?
Oh, sure, absolutely. And which is one of the reasons that a big part of our effort has really been focused on Medicaid reform, in addition to expansion, because we realize that we have to do things more efficiently in order to be able to continue to provide services to our most vulnerable Alaskans.
And Val, what other programs were affected this
year?
Sure.
So there were there were definitely some missed opportunities that we had opportunities to save more in the budget, if we had done, if the legislature would pass Medicaid expansion in the first 6 years of expansion, we would have saved $107.8 million cumulatively in state general fund. Some of those dollars would be in corrections. Some of those dollars would be in the catastrophic coverage, which is a program that we provide for with 100% general fund dollars. But our biggest opportunity for savings was actually in behavioral health grants. Recognizing that if we had Medicaid expansion, many of the folks would be able to be covered by Medicaid with 100% federal dollars and then transitioning down to 90% federal dollars.
And these are programs that are now 100% state funded?
Yes.
So we'd be substituting federal dollars for state funds?
Yes.
It's a big opportunity.
Yes.
Is there,
But even if I may, even without Medicaid expansion, one of the things that we have identified is over the next 6 years, same time period, even without Medicaid expansion, our reform efforts, we've identified about $240 million cumulatively in the first 6 years of Medicaid reform efforts. Things like, as we look at opportunities for saving state general fund match, for regular Medicaid, it's about 50% match. For children and pregnant women, the match is a little bit higher. But we also realize that there are opportunities right now for 100% federal match that exist even without Medicaid expansion. So if three things come together, if you have an IHS beneficiary or Alaska Native American Indian who's also a Medicaid beneficiary, who is seen in an IHS or a tribally operated facility in Alaska, the federal government actually reimburses the state at 100% federal match. So are there those kinds of opportunities that we can maximize that will allow the state to realize more savings in terms of general fund match, while at the same time extending our ability to provide health care to Alaskans who need it?
Val, you're sitting through the conversations at this conference. And of course your area is health and social services, but what kinds of questions are people asking about the department? Is it mostly about why is Medicaid so expensive, or why are health costs so high? Or?
Well, the number one question we heard yesterday in both of the breakout sessions was overwhelmingly, why aren't we doing Medicaid expansion? I mean, I expected that from the first group, which were really groups of folks who have been involved in healthcare, many of whom had been involved in healthcare for many, many years. The second group that came in was really a mix of people from different kinds of industries, and I was surprised that group also said the same thing. Why aren't we doing Medicaid expansion when it's clearly a good investment for our state? The other thing the thing that surprised me was that there was the correlation between the critical services was really the same between both groups. There was a question on Medicaid, the question of, are we investing too much? Are we investing not enough? Somebody asked the question early on, well, do I say Medicaid is too much right now if I support Medicaid expansion because that means because we realize savings, so do I put my dot on the too much? Or do I put my dot on the too little because I want Medicaid expansion? So we asked the group, well, how would you like to handle this? And the recommendation from the group came, add another column. People will vote twice on Medicaid. One will be, do they support Medicaid expansion, yes or no? And the other question was, do they think it's too much or too little? That would help to frame the conversation. And the support was overwhelmingly in support of Medicaid expansion and reform.
That's very interesting.
One thing that did surprise a lot of folks was there were a lot of red dots on pioneer homes.
Meaning red dots, meaning to not fund.
Yes, that perhaps there was too much money going into pioneer homes and that it wasn't necessarily as critical. Folks thought it was necessary, but the question we asked was, well, how did you arrive at this? Well, tell us a little bit about your rationale for this outcome. And what we heard from folks was we should look at privatization. The assisted living homes and skilled nursing home facilities exist in our state in the private sector. Is this something that the state should continue to support, or should it be a private function? And folks, I think, overwhelmingly agreed and kind of laughed about the fact that we recognize that Alaska has one of the fastest growing elder populations in the country. I think we might be the second fastest growing state. And there was sort of a humor among the group that, we realize that this is us that we're talking about.
We're all headed there.
Yeah, exactly. It's just a matter of when.
Yeah.
The question is, who should provide that service? And should the state subsidize that activity? And if so, what's the right amount?
Yeah. Well, Val, thank you for joining us.
Yeah, thank you.
I've enjoyed it. And this is Tim Bradner, and thank you for watching.